Hi, my name is Shelby Wages. I'm going to be demonstrating my proper hand hygiene checkoff. Proper hand hygiene is a critical part of any healthcare provider. It should be performed before and after seeing patients, before and after putting on sterile gloves, before and after any type of wound care, before and after coming in contact with any type of bodily fluids or excretions, when moving from a contaminated body area to a sterile body area, before entering work, before you go home, after any breaks you should have, pretty much all the time. You can use a alcohol-based hand sanitizer. You just want to make sure that your hands aren't visibly soiled when you're using just that, and you also want to make sure that your hands are completely dry before putting on any gloves or going back to work. So the first thing we want to do is assess our hands and make sure that we don't have any abrasions or lesions, and if we do, we want to properly cover those up. We also want to make sure that our fingernails aren't any longer than our pads on our hands, because that's where a lot of microorganisms like to hang out. So let's get started. Okay, so the first thing we're going to do is turn on our water. We want to make sure that our water is warm, not too cold, not too hot. So I'm going to wet my hands a little bit, being careful not to touch the edges of the sink. I'm going to grab 3 to 5 milliliters of hand soap, antibacterial hand soap. And then what we want to do is create friction when we're cleansing our hands and keep our elbows elevated and our hands pointed downwards. We want to make sure that we get our palms, the tops of our hands, and our wrists. We also want to make sure that we interlace our fingers, making sure that we're cleaning everywhere. We're going to do this for at least 15 to 20 seconds in order to be effective. Again, being careful not to touch the edges of the sink or any part of the sink. And then we also want to make sure that we clean underneath our fingernails. Make sure we get all those nasty germs out from under there. And then we're going to rinse our hands, and we want to do it from wrist to fingers. Being careful not to touch any part of the sink. Okay, so then I'm going to take my paper towel and turn off the sink. And then I'm going to dry fingertips to elbows. And that's how you perform proper hand hygiene.